Looking to elevate your COMLEX prep? Dive into RemedyOMM.com. Discover our comprehensive question bank, expert lectures, and personalized consultation services, all tailored for your success. Join the community of achievers. Visit RemedyOMM.com today and take the next step in your medical journey.
Hello everybody, welcome back to Remedy OMM. Today we'll be going over one of the more complicated topics, the sacrum. In this lecture, we will teach you how to diagnose sacral dysfunctions. To diagnose sacral dysfunctions, there are only two anatomic points you need to know. Superiorly, you have the sacral sulcus, which is also referred to as the superior sulcus or superior pole of the sacrum. Inferiorly, we have what is known as the inferior lateral angle, or sometimes abbreviated as the ILA. And that's it. These landmarks exist bilaterally, so of course we have left and right sacral sulci as well as right and left ILAs. When palpating these landmarks during your physical exam, you'll be able to observe if they are shallow or deep compared to the other side. Sometimes question stems will describe them as being more anterior or posterior. Typically, you would palpate while the patient is in a prone position, but as you can see here on the right, this physician is performing the exam while the patient is in a seated position. Here we can see him palpating the bilateral inferior lateral angles, and it seems as though the left ILA is a bit deeper when compared to the right. In addition to palpating the landmarks and figuring out which are anterior and posterior, you'll also need to perform a seated flexion test. The seated flexion test locks out the innominate, and so any other movement that occurs will occur through the sacrum. Have the patient seated with their feet flat on the floor and spread shoulder width apart. Palpate just inferior to the PSIS on both sides and have the patient bend forward as if they were to touch their toes. As the patient is performing this motion, you want to observe which side moves first and furthest. That will be the side that is considered positive. In the example picture on the right, you can see that the right PSIS moves slightly further than the left. Therefore, it would be considered a positive seated flexion test on the right. Now the question is, what does the seated flexion test tell us? It tells us one of two things. It tells us that the oblique axis of rotation of the sacrum is opposite the side that is positive, or it tells us that we have a unilateral sacral flexion or extension on the same side that's positive. For example, if we are performing a seated flexion test and the right PSIS moves first and furthest, then we know we have a positive seated flexion test on the right. What this tells us is that we have a left axis of rotation, as you can see in the picture on the right, which we will need to know when diagnosing a torsion, or we have a unilateral sacral or extension dysfunction on the right side. We'll talk more about torsion dysfunctions next, but knowing how to interpret a seated flexion test is a major key to diagnosing sacral dysfunctions. This will make more sense as we continue and see some more examples. Here we see a picture of the four possible sacral torsion dysfunctions. Torsions are described by the side that they rotate towards and the side that the oblique axis is on. For example, a left rotation on a right oblique axis. This is usually shortened to just saying left on right. Torsions are divided into two categories, forward torsions or backward torsions. Basically, if the dysfunction is right on right or left on left, it is considered a forward torsion. And if the dysfunction is left on right or right on left, then we have a backwards torsion. In this picture, you can see that by knowing the axis of rotation, which is information we can get from the seated flexion test, and combining that information with the palpation of the bony landmarks, we can figure out which torsion dysfunction the patient has. Let's look at the picture on the top left. The oblique axis of rotation is on the left, which means that we must have a seated flexion test positive on the right. Remember, the seated flexion test tells you that the oblique axis that is opposite of whichever side is positive. Palpation of our four corners, the sacral sulci and the ILAs, shows that the right sulcus is deeper than the left, and the left ILA is shallower than the right. This tells you that we have rotated left on a left oblique axis sacral torsion dysfunction. For a unilateral sacral flexion or extension dysfunction, recall that these occur on the same side of the positive seated flexion test. On palpation of the sulci, you'll notice that one is deeper or shallower than the other, and that will clue you in to whether you have a flexion or extension dysfunction. For flexion dysfunctions, we have a negative lumbosacral spring test and sphinx test, which I'll get to those and what they are on the next slide. And for extension dysfunctions, we will have a positive spring and sphinx test. A lumbosacral spring test is when you have the patient lying prone, you apply posterior to anterior pressure, springing on the sacral base. A lack of spring indicates a bilateral or unilateral sacral extension or posterior sacral torsion. Normal spring indicates a bilateral or unilateral sacral flexion or anterior sacral torsion. The sphinx test is when you have the patient prone and you monitor the sacral sulci. You ask the patient to move into the sphinx position, which involves having them lie prone and prop themselves up on their elbows to extend the lumbar spine and sacrum. If the test is negative, that means that they have improved symmetry of the bases. This indicates a sacral flexion dysfunction or an anterior sacral torsion. If the test is positive, meaning worsening of the asymmetry of the bases, this indicates a sacral extension dysfunction or a posterior sacral torsion. Using these special tests, as well as your physical exam and palpation, you will be able to diagnose sacral dysfunctions. However, you may come across different questions that require your knowledge on the movement of L5 vertebrae in relation to the sacral dysfunctions. Two important things you should know here. First is that L5 and the sacrum rotate in opposite directions. This is easy to remember as it is intuitive. If the sacrum is rotated left, then L5 is rotated right. Simple. The other point is that the oblique axis for a sacral torsion is on the same side that L5 is side bent. So if L5 is side bent right, then the oblique axis for a sacral torsion will be on the right. That's all I have for you today. I know that's a lot to take in. We have a few practice questions in the next video to help you out. Check out that video now. Please like, subscribe, and support our channel. If you have any questions, please don't hesitate to comment below. We will see you guys in the next lecture.